Today we're talking about acute coronary syndrome. Now, if you've never heard of this, you've never even seen these words before, that's okay. We're going to go through it step by step. Now, something I like to do when I encounter a new diagnosis or especially a new medical term that I don't understand is I like to break it down into the individual words. And I think this is just a good tip for life. Sometimes if you don't understand a larger concept, if you can break it down into smaller pieces that you do understand, you can make sense of what's going on. So let's do that now. Something acute is something new or recent in onset. So this is the opposite of chronic or ongoing. Coronary refers to the vessels of the heart, and specifically we're talking about the vessels of the heart that supply the heart muscle. So the heart's own blood supply, if you will. And finally, a syndrome is just a group of symptoms. So even if you've never seen this term before, you can figure out that acute coronary syndrome must be a group of symptoms that have come on recently that have something to do with the vessels of the heart. And you'd be right. Specifically, what we're talking about is blockage of these arteries. And so you can see that the coronary arteries kind of surround the heart muscle, and they're the ones providing it with blood. And what happens is that these arteries can get blocked with cholesterol plaques. And so what happens when you have a buildup of these plaques is that blood can't get through. Well, if you don't have blood getting through, then you don't have oxygen, right? Because the blood is carrying the oxygen supply to the heart. So what happens is you end up having parts of the heart muscle that are starved of oxygen. Now, what does this look like when that happens? Well, in some cases, it presents as a heart attack. In other cases, it can present as something like unstable angina. And so if you're thinking, well, I wonder if a heart attack or unstable angina can be causes of acute coronary syndrome, the answer to that would be yes. Heart attack and unstable angina are actually the two main causes of acute coronary syndrome. Okay. Now, what does this look like? If you saw a person, say, in a restaurant or on the street that was experiencing this, how would you know? Well, the first thing is the person may be clutching their chest. And this is because people who are experiencing acute coronary syndrome often complain of chest pain or tightness. And you may hear them say things like, it felt like an elephant was sitting on my chest, or I felt this pressure. There's a sense of tightness in the chest, which is where the heart is, right? They may also complain of pain in their left arm. They may say that it's radiating or it's kind of pulsing or traveling down their arm. They may complain of jaw pain. Often people say that their hands, both the left and the right hands, may be heavy. And all of this is related to symptoms of the heart. Now, in addition to that, you may see things like sweating, shortness of breath, dizziness. And so these aren't specific to an acute coronary syndrome, right? These can happen in other times of distress, but these are just general symptoms of distress that you want to look out for. And the reason for that is that in certain populations, like in women and in diabetics, these symptoms of acute coronary syndrome aren't the same. And specifically, things that we look at like chest tightness or the pain in the left arm that you kind of think of as being classic heart attack symptoms, they may not happen at all. And so you may be looking for some of these general signs of distress, as well as things like pain in the upper abdomen. This is often a symptom of heart attack in women, or pain in the back. Things like fatigue, nausea, again, very general symptoms. And in diabetics, sometimes the onset of a heart attack can be so slow that they don't even notice these things. And so you might hear this sometimes referred to as a silent heart attack in diabetics. Okay, now how do we know for certain that what is happening is an acute coronary syndrome? Well, there are a few tools that we use. The first one is an EKG, and this stands for electrocardiogram. Now, you may have had this done as part of your yearly physical, or if you've ever had a stress test like what this gentleman is doing. And so basically what an EKG does is it measures the electrical activity of the heart. So there are leads or little sticky pads that the doctor sticks on your chest, and there can either be 3, 6, or 12 leads to an EKG. And these transmit information back to a machine, and the machine interprets that information on a printout like this. And so not only can your doctor figure out what the electrical activity of the heart is, it can figure out what direction it's traveling in. It can figure out whether certain areas of the heart aren't functioning, if there are certain vessels that are blocked. And so the EKG is the main thing that you're going to use for diagnosis. Now, in addition to this, you may have a chest x-ray and you may have blood tests. Now, for blood tests, what we're looking for are certain breakdown products from the heart muscle. The main one that you may hear spoken of is troponin. And so what happens when the heart muscle is starved of oxygen is, unfortunately, it starts breaking down, right? And so some of these breakdown products end up in the blood. And so by doing these blood tests, we can figure out whether or not a heart attack has happened and how recently or how long ago it happened. All right. Now, what do we do to prevent this? Because acute coronary syndrome is not something we want to have happening. Well, the first thing is to quit smoking. And this isn't just true for acute coronary syndrome. This is true for any number of chronic illnesses like diabetes or hypertension. Smoking just makes every system in your body worse. So quitting smoking is the best thing that you can do to prevent this. Second of all, you want to watch your diet and exercise. Now, when we say diet, we don't mean going on a diet, although that might help depending on what you're eating. We're talking about limiting the amount of fat and cholesterol in the diet. Now, remember we said acute coronary syndrome was caused by a blockage of the arteries with cholesterol. So you can imagine that if you are eating too much cholesterol, it's going to go somewhere, right? And so you're going to end up with increased plaques and increased blockages. Now, exercise, in addition to helping your heart to function better, also increases the blood flow through these and other arteries, and so that also decreases the amount of blockages that you have. So that will help to prevent acute coronary syndrome. Now, finally, you want to take your medications as prescribed. Now, this may go without saying, but sometimes we don't think about how other systems in the body are related to the heart. But by keeping your overall health intact, you can prevent other things from going wrong, like acute coronary syndrome. So you want to take medications for any other illnesses that you have. And if you've ever had heart problems in the past and you're taking something like aspirin or a beta blocker, you really want to make sure that you're taking these medications to maintain your heart function at the optimum level to prevent acute coronary syndrome from happening.